Welcome to the Thyroid Fixxr podcast, where I'm all about helping you lose that stubborn weight that won't come off no matter what you do. Get off your couch at 2 p.m. and get through your day with energy and stop counting the hairs that come out of your head. I'm your host, Dr. Amie, and I'm here to help you get optimized with your thyroid and your hormones. It's all part of living our mantra: better thyroid, better hormones equals a better life. So let's get you back to being the badass human that you're meant to be. Let's approach it from a thyroid and hormone optimization standpoint. Between myself and my guests, you will be loaded down with information to take control of your health and get back to being you. So let's get started. Did you ever come home from a really long day? Your energy's drained and you just want to sit down and watch Netflix and eat a good dinner, but you got to still squeeze in your workout. So how about if you actually got home at 7 and your workout was done by 7:05? Does that blow your mind? You're already done. You're unwinding. That's the reality with Carol Bike. In just 5 minutes, you experience a workout that is scientifically proven to be as effective as a 45-minute run. Carol isn't just a time saver. It's your literal shortcut to health, happiness, better muscles, lower body fat, leaving you more time for what actually matters in life, like watching Netflix and eating a great dinner. So if you want to check out Carol Bike, they give you a warranty, a trial period that is unmatched. You'll even come get it if you don't like it. 30 days. I mean, who can even beat that? So check it out. Go to carolbike.com, carolbike.com. You're going to use the code Dr. Amie if you grab one of these bad boys, which I highly recommend doing. You're going to use the code Dr. Amie. That is going to save you $100 off. And again, there's no risk. There's no risk. Try it for 30 days. If you don't like it, they will come pick it up. But I guarantee you the time-saving aspect, the muscle building aspect, the fat burning aspect, you're just going to love it. Are you trying to lose weight? I mean, most of us are, but when you cut calories or you use those new Beverly Hills soccer mom drug of choice for weight loss injectables, you're not going to get in enough protein. And that's the problem. That's where you start losing muscle and fat at the same time. You don't want to lose your sexy lean muscle. So Kion Aminos helps prevent muscle loss. Kion Aminos can help you feel full when you're cutting calories, which that's a bonus. And it's going to help you build that lean muscle for a faster metabolism, a lean, toned, sexy body. So add in Kion Aminos. I do it every single day. I drink them during my workout, and then I'll also drink them throughout the day because that's supporting my muscles, keeping my muscles as I'm just sitting at my desk working. Add in Kion Aminos, try them out. I love the berry. I love the mango, but you're going to love all the flavors. Toss it in your water, shake it up, drink it throughout the day. And then, like I said, definitely during a workout. So you are going to use my link to save 20% off. So that's a no-brainer for you to try these out. You're going to go to getkion.com. That's GETKION.com/thyroid. And that is going to give you 20% off your first order. Let me know what you think. These are the 5 hormones that contribute to weight gain or that contribute to weight loss, whichever way you want to look at it. If they are on point and optimal, then you're going to lose weight easily without thinking about it. A little bit of effort, right? Just watching what you're eating, cutting out the processed foods, of course, cutting out the sugar. It's not like you can optimize these hormones and eat whatever you want. But when you are doing all the things like so many of you are doing, you're going to get rewarded for those efforts of actually taking care of yourself, getting the right sleep, getting in enough water, lifting heavy shit, decreasing your stress when you can, when it's controllable, and watching what goes into your mouth. Really, basically eliminating what I just said. Anything processed, anything in a box, anything containing sugar. And God forbid you're taking in any kind of seed oil. That's going to contribute to weight gain as well. But once you focus on these 5 hormones, you'll find that weight loss is so much easier. And if one of these is off at all, you will notice that weight loss is very difficult. In fact, you might be dealing with weight loss resistance, and it's just not going to come off whatsoever. Not at all. Okay, let's start with T3. My goodness, you've heard me talk about this so much. T3 is the active thyroid hormone. And once again, all of you with diagnosed hypothyroidism or Hashimoto's, if you are on T4 only, which is really the standard of care in conventional medicine, you go to your doctor, you get diagnosed, they give you T4, and they pat you on the head and wish you luck on your journey. And that's about it. That's all you're going to get. If you are on T4 only, you are going to be at a metabolic disadvantage moving forward. What I mean by that is that T4 only works in 2% of the population. 98% of us with hypothyroidism need T4 and T3 or T3 only. And the reason for this is that T4 has to convert and become T3. So T4 is inactive, T3 is active. T4 becomes T3, it converts over, and it converts in the thyroid gland, the gut, the peripheral tissues, the liver. And then that active thyroid hormone T3, what we're talking about right now, gets to the cell like a lock and key mechanism, turns on the cell, turns on your metabolism, grows your hair, strengthens your nails, gives you a good mood, all of that. So we need adequate amounts of T3. And in order to get that, we have to use T3. We have to use Armour thyroid or NP thyroid, or we're using Synthroid and liothyronine combined, T4 and T3 combined. So you need T3 in your life, whether you really, really focus on conversion, which again, just improving conversion of T4 to T3 probably isn't enough if you're on T4 only. It's going to help. Yes, you want to do all those things that improve conversion, like iodine and magnesium and selenium and reduction of cortisol and controlling your insulin. However, it's a very tough job for T4 to convert properly over to T3. I equate it to running 5 tough mutters. This is why I push for some T3 in your treatment options. When you are being properly treated and you're working with someone who knows what they're doing with the thyroid, you will not be on T4 only. So if you are on T4 only, I suggest running far, far away from that doctor, because that's what you'll be on the rest of your life. And unfortunately, you will be fat, frustrated, and fatigued the rest of your life if you stay on T4 only. Now, there is an option, and that is T2. So that is our second hormone. T2 is metabolically active. It actually raises your basal metabolic rate. So if you are stuck on T4 only, this is where I suggest adding in T2 or thyroid Fixxr. That's why I brought it to market. It's been on the market now 2 years, and I've been studying it for 15 years, and it has been studied for 30 years. This is a 30-year-old researched hormone that is still not controlled by big pharma. So let's do a little happy dance there, that we don't have to go to our doctor like we do with T3 and beg for it, or convince your doctor that maybe they need to open an endocrinology textbook and look at what the body needs and look how T4 is inactive. But that's a whole nother rabbit hole to go down, another pedestal for me to stand on. Back to T2. T2 has been proven over 30 years to increase your basal metabolic rate. So you are burning fat while at rest. It also works at the mitochondrial level to produce ATP. So that is going to improve your energy through the day, another bonus. In order for you to have a metabolism, you need T2. Now, your thyroid gland makes some, and if you're on NDT medication like Armour or NP thyroid, you're getting a little bit, but not enough. Not enough per the studies. Now, the studies were using 150 to 300 micrograms in the human trials. And what they found in the human studies is that people using 150 to 300 micrograms daily of T2 or 3,5-diotyl-L-threonine lost an average of 9 pounds in 28 days. They also saw a 4% reduction in body fat mass. That's big. 4%, that's huge. In a month, that's a big deal. We're also seeing that it does not shut down your thyroid. So there's no negative feedback loop that occurs with T3 where your doctor is going to look at it and freak out that your TSH dropped and your free T3 is too high. That's not going to happen with T2. Now, an iodine molecule can come and attach to T2, and it can become T3 where you might get a little bit of a bump up in your free T3 value. And by a little bit, I mean you might move from a 2.5 to a 2.8 It's not all of a sudden going to push you into the optimal range, but it doesn't have to because it's working at the mitochondria level to increase your metabolism, increase your resting metabolic rate. It's also working like a cold plunge in that it is activating brown adipose tissue. So it's turning your white adipose tissue, the squishy, unhealthy fat on your body that you want to get rid of and that's surrounding your organs, it's turning that into brown adipose tissue, which is very thermogenic, very, very protective. Brown adipose tissue helps to lower insulin resistance, helps to improve insulin sensitivity. So we want that. We want to activate our brown adipose tissue. And T2 is also acting like an exercise mimetic, meaning that all the benefits that we get from exercise, like improved insulin resistance, improved cardiovascular function, lowered body fat mass, increased muscle mass, we also see that with T2. Now, there's no test for T2. So if you're sitting there going, well, how do I know if I need it? You really don't have to test for it. There's no commercial test available. They use the test in the studies where they showed that 9-pound average weight loss, 4% reduction in fat mass. They did use T2 assays in studies, but there's nothing available to the general public. I would expect to see that in the next couple of years as T2 gains more attention. However, we almost want to keep this under the radar because we certainly do not want Big Pharma stepping in and taking our T2 away from us in supplemental form, where we then have to go and beg for our doctors to please prescribe us T2. We don't want that. We don't want that. I am so thrilled to introduce you to Hormone Solutions by my dear friend, Karen Martell, hormone expert, by the way, in all things peri and postmenopausal for you ladies, but she's also a passionate advocate for clean, safe products. So that's why she created Hormone Solutions, a line of over-the-counter bioidentical hormone creams, free of the fragrances and the parabens that we want to avoid, of course. So let's walk you through a couple of them. First of all, ProgestCalm. We know progesterone is amazing at calming your nervous system, helping you sleep. It inhibits breast tissue overgrowth, so promotes breast health. And then we have Estro 2 Rejuvenate. This is an amazing face and body cream. I love what it does for your skin. It is so silky smooth, and it plumps wrinkles and helps with collagen formation. Then we have Estro Vitality. This is the estradiol cream. So relief from pre and postmenopausal symptoms, hot flashes, night sweats, the mood swings, all the things. She has really put her heart and soul into this line. I love her for bringing this to the masses so you can all experience the power of bioidentical hormones safely, effectively, without the need to go to your doctor and beg for a hormone prescription, right? So what you're going to do, you're going to click that link in the show notes and you're going to use the code Dr. Amie. That is going to save you some money when you try out Hormone Solutions. Okay, next up in the hormone list is insulin. Insulin, fasting insulin. When you get that tested, you want to go in a fasted state. We want that number below a 6. If you are above a 6, you are insulin resistant. I don't care what the standard lab value range says. If you are insulin resistant, there are multiple reasons for this. Number one, of course, is carbohydrate intake. We know that that really is one of the biggest drivers of elevated insulin levels. Number two is stress. So stress can absolutely increase insulin levels, which is why I say we have to do all of the lifestyle and dietary changes that we need to do and that we know we need to do, like controlling our stress level. We need to do that in order to really discern whether or not we have an underlying problem, or is it just our behavior and what we're actually putting in our mouth that's the problem. Now, age, of course, just being over 45 puts you at a greater risk of higher insulin. Family history, having a biological parent or siblings with diabetes or insulin resistance or polycystic ovarian syndrome, that's going to put you at a disadvantage for controlling your insulin. Having high blood pressure, abnormal cholesterol levels, heart disease, if you had a stroke, if you have high triglycerides or high uric acid, that can absolutely put your insulin over the top of where we want it to be. Taking certain medications, if you're on immunosuppressants or prednisone, God forbid, long-term prednisone use, that actually can cause type 2 diabetes and definitely insulin resistance. So what you want to do is, number one, make sure that you do check your thyroid, because having an abnormal thyroid or a non-optimized thyroid, or again, if you're on T4 only, you don't have an optimized thyroid. So checking your thyroid levels and optimizing your thyroid will very, very often bring down insulin levels. The other thing I would want you to do is to check all the different factors that we just said and track your food and add in berberine. Add in these glucose disposal agents like berberine, like bitter melon, cinnamon, all of these, or even metformin. All of these glucose disposing agents help to control blood glucose levels and thus also help control insulin levels. Next up is leptin. Leptin is very tied into insulin. When we have insulin resistance, we often see leptin resistance. And leptin is our satiety hormone, meaning it tells the brain that you're full, like you're good. You don't need to keep eating. When we look at the causes of high insulin, we also see them overlap with the causes of high leptin levels. Now, if you're obese, since fat cells produce leptin in proportion to their actual size, people who are obese naturally have higher levels of leptin. And you would think, well, if you have higher levels of the satiety hormone, wouldn't that help with obesity? Because it's going to actually help you be fuller faster and stop eating? Yes, but the problem is that high leptin, just like high insulin, it causes resistance at the cell level. So leptin actually can't get into the cell and do what it needs to do. Same with insulin. If insulin can't push nutrients into the cell and help lower blood glucose levels, which is the job of insulin. Insulin is not a bad hormone. We want it. We just want it in the right proportions. Same with leptin. It's not like we don't want to push leptin to zero. In fact, when I see low leptin levels, I always ask the person, are you starving yourself? Do you have a history of an eating disorder? Because that's where we see low leptin. But too high of leptin, anything above a 10, we really like leptin below a 10. Anything above a 10 can increase your leptin and thus leptin resistance. Lack of sleep. So we know that when we disrupt sleep or we don't get enough sleep, we can immediately cause type 2 diabetes. We can immediately increase your hunger. And absolutely, we can cause insulin resistance. But it turns out that lack of sleep also increases leptin. And that's why you are starving the next day when you only get 4 or 5 hours of sleep. You're like, why is it that I can eat absolutely everything in sight? Well, that's why. A little bit of leptin resistance. Chronic inflammation, inflammatory foods, high in sugar, processed foods, just like we talked about with leptin or with insulin, we have to cross over and talk about it with leptin because these foods will promote leptin resistance. Just increased food intake. So when you sit down, let's say you have a really big meal and you walk away like, oh my gosh, I'm so full. I should have stopped earlier. I can't eat another bite. Those large meals that are really high in calories, those can also increase leptin levels. Now, in a normal functioning body that doesn't have issues with weight and really doesn't even need to listen to this podcast, then the leptin signaling is going to occur as it should. So leptin increases with that large food intake to tell your body, to tell your brain, stop eating. Like you have enough here. That's good. And then, of course, leptin levels will fall back to normal eventually in a healthy body. The problem is that when we have that high leptin all the time, along with inflammation, along with, let's say, hypothyroidism that isn't being treated properly, along with carrying around excess fat, now we have a problem because, again, the signaling to the cell gets disrupted and we see leptin resistance because of all that elevated leptin in the body. It's actually making the cells resistant to that leptin. And then there's excess leptin in the bloodstream, which makes losing weight very, very, very difficult. Very difficult. We also see that those high leptin levels can lower growth hormone. It can lower TNF alpha. So it's really not a fantastic place to be in for not just your weight, but for your overall aging and longevity. We want to keep leptin levels low. And finally, the fifth hormone is testosterone, RGSD hormone. Here's the thing with testosterone. So we know that we need optimal levels of testosterone. And I've talked about this in other podcasts. Optimal level total for a woman is above 50. Optimal total for a man is 800 to 1500, depending on your age. And then we go down into the free. So the optimal free testosterone for a woman, I like to see it right around 4. And then the optimal free testosterone for a man is 20 or above. Testosterone helps us maintain our muscle tissue. So as our testosterone levels drop, so does our ability to hold on to lean muscle mass. And now with the increase of GLP-1s, we're seeing a reduction in lean muscle mass, which is a problem. When we pair that up with low testosterone levels, then that becomes really a dangerous situation as we age, because we already know that sarcopenia, or lack of muscle, loss of muscle, occurs with age. So as we age, we actually need more protein to protect our muscle, and we need adequate testosterone levels to protect our muscle. Now, we know that muscle is metabolically active. So as you lose muscle, as you lose lean body mass, your overall metabolism will drop. So that daily burning of calories, that resting metabolic rate, that will decrease as your testosterone levels drop. This is why we use testosterone replacement, bioidentical testosterone hormone replacement, in men and women to keep their testosterone levels optimal. Now, testosterone has a host of other benefits: heart protection, brain protection, bone protection, protection against cancers of all kinds, specifically in men, prostate, testicular. We also see protection of the breasts in women. Testosterone has a host of other benefits. But when we're talking about metabolism and fat loss specifically, if we do not keep our muscles, if we don't go and lift heavy shit to activate that GSD hormone, then we will lose our muscle and thus increase our body fat because of the reduction in metabolism that occurs with the loss of muscle mass. Now, adding in testosterone doesn't directly boost your metabolism, but it does so in the way that we just described, in improving your stamina, your endurance, your muscle mass. So you'll find at the gym, well, even your motivation. Like I said, testosterone is the GSD hormone. You will not get anything done if your testosterone levels are low. Are you really going to want to go to the gym and really push through a crazy ass AMRAP workout or do some deadlifts and squats? No, you're not going to want to do anything. You're going to get to your gym and you're going to do 2 sets of 12 reps with a baby weight, and you're going to be so exhausted that you're going to want to leave. And then your muscles are going to be sore and you're going to complain you don't recover quickly enough. Low testosterone people, you need testosterone ongoing if you want to have an athletic, lean, muscular, fit, healthy body. We need optimal testosterone levels. So again, the 5 most important hormones for fat loss: T3, T2, insulin, leptin, testosterone. If you need to listen to this again, do so. Take some notes because it's going to be really, really beneficial for you. And then I'm also going to put a link down in the show notes so you can download the difficulty losing fat download. And that will help you with your journey to fat loss. But pay attention to those hormones, get them checked, make sure you're in the optimal ranges, add in some T2 in your life to increase that basal metabolic rate. And then, of course, if you are working with a doctor that has you on T4 only, please remember that we can prescribe to all 50 states and most of Canada. So if you do need help in this area, proper testing, proper treatment, bioidentical hormone replacement therapy, the right thyroid treatment so that you actually can get your life back and not walk around fat, frustrated, and fatigued, let me know. Hey guys, thank you so much for listening to the podcast. I hope you loved it. And as always, if you would be so kind to leave a review if you are listening on Apple Podcasts, that would be absolutely amazing. I read all of them. Also, anything that you hear on this podcast is not intended to diagnose or treat any kind of medical condition. So we always recommend that you check with your medical provider, your doctor, your nurse practitioner before implementing anything that you hear on this podcast. And if you want to find out more about working together, you can click the link below in the show notes to book a discovery call. And there you'll be talking to a member of my team. They are an extension of me. They are amazing. And you and I will talk after that once we get you all signed up and you and I get to work together. All right. I hope to see you soon.